Healthcare in America is at a turning point. Family health insurance premiums have jumped 47% in the last 10 years. Chronic disease now affects nearly 77% of American adults, and more than 50% have 2 or more chronic conditions. Real reform is necessary. Victress Health and Wellness brought in Congressman Jim Jordan to share what's working in Ohio to drive down healthcare costs by over $4,000 per employee per year. Here are those solutions.
Well, hello everyone. Thank you all so much for coming. My name is Erin Hazelbaker and I am the CEO of Victress Health and Wellness. We are a full-service medical clinic devoted to free market healthcare. My goal for today is that everyone will walk away understanding that there are real solutions for local employers and communities for the healthcare rising costs that we're all feeling. I want you to know what those solutions are and that they are working, and what steps you can take next to really help lower your cost, either within your own family or your business. We're thankful today to have Representative Tim Barhorst, Mayor Dan Lee, Commissioners Bruce Metz and Mac Knupp, Lori Brody with Senator John Husted's office, and of course, Congressman Jim Jordan. So if you don't mind, go with me here for a minute. I want you to imagine that you're in your car, you're driving down the road, it's a snowy day. All of a sudden, your oil light comes on. Shoot, yeah, I forgot to do that. You go a little bit further and you're out of windshield wiper fluid. Doggone it. Darn the bad luck. At the next light, you stop and your check engine light comes on. Oh my goodness. Well, I'll be just a little bit further down the road and the dang blinker goes out. Now, shift gears and think about how we treat healthcare. That twinge in your back, that stomach weirdness that's kind of getting a little worse and it's just not comfortable. That cold or flu or COVID or whatever it is that kind of hits you and just always starts on a Friday night. That checkup or those labs that you've been avoiding. Now shift gears back to being in the car. Did you pull over and call your auto insurance guy? No, you called your mechanic. So why, when we're talking about healthcare, do we shift everything to health insurance instead of just calling your local provider? Well, when we think about it, that's how insurance has gotten so big and conflated and bloated. It's because we've outsourced every little thing, the blinker and that COVID that you think you might have, you know, the challenge with your stomach and the oil light coming on. It's all together, and the car industry has done a great job of kind of keeping those separate, but for some reason in healthcare, we just continue to allow it to get bigger and bigger and bigger. So here at Victress Health, we're a direct primary care provider. And direct primary care is membership for your health care. You or your employer pay a low monthly fee for unlimited visits, calls, texts, and interactions with your provider. Being accessible allows us to be more preventative and proactive, like the windshield wipers or the oil change that we were just talking about. So what can direct primary care do for you? Well, what we've seen is 40 to 65% fewer emergency room visits. We let the ER handle the true emergencies. I have a sister that's an ER doctor, and she is frustrated day in and day out by the amount of silly things that she feels like could have been handled by a primary care team that she's now having to handle as an emergency room doctor, which means that we're clogging up our emergency rooms when really it's those true emergencies that we want to be handled there. We also can see 20 to 40% drops in hospital stays or specialist needs because the small issues get handled early, quickly, and cheaply. Same thing goes. You don't call your auto mechanic when you know it's a transmission issue. He refers you to the specialist, the transmission guy. It's the same thing that happens here. We take care of the small issues and we try to help you as best we can, but we also know that there are specialists for a reason, and we'll refer out when the time is right. And Congressman, last time we spoke, we pushed for the IRS to allow people to use their health savings accounts, those special tax-free savings for medical bills, to pay for direct primary care services. We're so thankful because the great news is that rule went into effect 16 days ago, which is amazing. So now our patients can use their own hard-earned HSA dollars in the kind of care that really gives them the best value. But again, we know that it takes years, because I believe, Congressman, if I'm not wrong, I think it was about 1.5 years or 2 years ago was the last time we were together and we were asking for this change. So we know that the changes in Washington don't happen overnight. We don't stop advocating, we don't stop asking, we don't stop talking about it. But if we can experience these things right here and right now in our own communities, that's what we hope to do. And that's why I'm happy to introduce Scott McKenzie, Vice President of Human Resources at US Plastics. Thanks, Scott.
Thanks, Erin. Yeah, US Plastic has partnered with Victress now a little or close to a year, and we're seeing a lot of just great, amazing testimonies of just how through functional medicine and the longer discussions, it's just not, hey, let's treat the symptoms. It's getting to that root cause. So we just appreciate everything that Victress does, and our employees are seeing that benefit. So thank you.
Great.
Yep.
Thanks, Scott. Yeah, I appreciate that. Well, and that brings us to Christina King, the founder and president of CNA Benefits. Now, we know that there are many ways that advisors can help employers to save on the rising healthcare costs. But CNA brings together independent partners to promote competition and choice for employers. Christina?
Thank you. So I have 45 minutes to talk about this.
Yeah.
No, this is my passion. This is my mission. I've been a broker for 25 years. I call myself a recovering broker because I thought I was doing a good job. And what I learned several years ago, and I started this in Logan County with Mary Rutan, the fix to healthcare is already out there. Sorry, Congressman, but none of us, I think, believe the cavalry's coming from Washington to fix healthcare, okay? It's done here locally, and it's done through transparent partnerships. And so surprisingly, there's 3 components in every health plan that you can fix, okay? And it will make your health plan costs go down and provide better outcomes for your employees. We're actually giving employees a health plan that they can afford to use. The 3 components are prescription drug costs. This is lowest hanging fruit that you can handle, that you can fix in your health plan. There is so much overspend and waste in prescription drugs. I had a school district come to me and say they have a budget shortfall, and this is in the eastern part of the state. Budget shortfall, they need $1 million. Find $1 million in our health plan. They couldn't get the data from Anthem. So when we finally got the data, and it was just partial data, there was $843,000 of markup on just their top 20 medications. That's like, there's your $1 million. There's probably $2 million there. The second one is good primary care, direct primary care. For some reason, primary care has become a loss leader in our health plan, and it needs to be a foundation. Or primary care has become that referral to specialists and into the hospital and to more tests. And the third is working with hospital systems for the high cost inpatient, outpatient services. So here's what I found out about 3 years ago. Someone had told me that Mary Rutan was trying to put together a community health plan, and they had been trying for 5 years. And so I went with them and I'm talking to them, and here's what I learned. The big insurers are paying the hospital systems about 90 to 180 days out, and sometimes up to a year. They deny about 40 to 50% of their claims. So they have a full staff of appeal to try to get paid. Once they do get paid in about 6 months or more, they have to go chase larger patient responsibility. So we sat down at lunch and I'm like, well, what are we doing? Right? We've all been kind of like mind warped that it is what it is. There's nothing we can do about it. So I sat down with the executives. I said, what if we paid you quicker? And what if you didn't have to chase patient responsibility? So what we've been working on for 3 years around the state with different hospital systems, and now the word's getting out, they're starting to come to us and say, can you help us in our community? And what that means is that we're paying them within 8 days of date of receipt. And if the employees stay in that community, get the care they need, they have a $0 deductible, they have $0 copays. If it can't be managed in that community, then we're sending them out to specialty hospitals such as Ohio State for cancer care or Nationwide Children's for NICU babies. But if the care is kept in that community, we're eliminating employees out of pocket. But we're all Americans. We want the choice to go wherever we want. So we have hospital systems all over the state that say, I want to do this. We want to partner with you. We want to build the care locally in our community and keep it in our community. We have hospital systems, the large ones, who say, we don't, and it doesn't matter what we charge. People are still going to come here, and they're charging 7, often 10 times more than the local hospital systems. So we tell our members, we're like, go wherever you want. If you want to go, I'm sorry, Premier, they're 7 to 10 times more than if you keep care here. If you go to Premier, you're going to have the health plan you have always had. If you stay in the community, if you stay here in Lima, if you stay in Mary Rutan, if you stay at Wilson, if you stay, at all these community hospitals, we're eliminating your out-of-pocket cost. That's how you fix healthcare. The win-win-win is that the community hospitals don't have the leakage that they typically do to the metropolitan areas. So we're keeping the local independent hospitals viable in our communities, and that's so, so important. The second win is employer premiums are decreasing. We're saving employers on average about $4,000 per covered employee per year. And we're actually giving employees a health plan that they can afford to use. We're all spending a lot of money on healthcare that our employees can't afford to use. And so the fix is out there. We're doing it all over the state. And what's most exciting, we have about 30 regional hospital systems that are coming to us now and saying, help us do this in our community. And so the eyes of the nation are really on Ohio right now, saying, look what they're doing. I get calls from hospitals in Kentucky, Indiana, Tennessee, Georgia, and saying, come out here and help us do this, what you're doing in Ohio. So this is really exciting, and this is an opportunity for us to change the trajectory of healthcare starting here and then moving outside of Ohio. So thank you.
Thank you. Thanks, Christina. So we say this all the time. We really value our local partners, and we're excited to continue to team up with them. Finally, Bruce Suchland is a certified nurse practitioner. We asked Bruce to speak about providing care inside of the direct primary care model, because it certainly is different. And so, Bruce.
All right. I brought notes to try and keep myself on track, because whenever I get started talking at home, my kids are always like in their best dad voice. Well, back in my day, right? They know something's coming. They know they're going to hear a long-winded story. But not to let you down, back in my day, back in the 1990s, a different millennium, there was an old fast food commercial, right? And if anybody remembers this fast food commercial, it was wake up, go home, go to bed. Wake up, go to work, go home, go to bed. Wake up, go to work, go home, go to bed. And they lulled you to sleep, right? Everybody's starting to lay back in the recliners. Grandma's getting up to go get a snack from the refrigerator. And all of a sudden a plot twist would come in, right? They would jump in the middle. Does anybody remember it? Wake up, go to work, go home, plot twist. Go to Arby's, right? Color would come back on. It was black and white commercial. Color would come back on. Grandma would fall over the ottoman. We thought she was going to die. We didn't know what was going to happen. No matter how many times they ran that commercial, you just get lulled to sleep. You think, they're not going to do it this time, right? They're not going to do it. And it would happen every single time. That's how I see Victress Healthcare. And right now, Erin is panicking because she has no idea where I'm going with this, and she's regretting letting me coming up here without proofreading the speech, right? All right. The way I see that is traditional healthcare is wonderful in a lot of ways. We can intervene in patients' lives. There's modern medicine. There's cutting edge techniques to save lives, to keep people living healthier for longer, but it's become a bit mundane, okay? Sometimes it's a little cookie cutter approach. Everybody that comes in with symptom A, B, and C is going to walk out with medication 1, 2, and 3, okay? We know what's coming in healthcare, and it can be good in a lot of ways when it's needed. What we try to offer here at Victress is a little plot twist, okay? That little bit of color back in your day, a little bit of conversation back in your health. What else? What else is out there? What else is different? And there's a lot of phenomenal hospital-based providers out there who do wonderful work and talk about supplements and will talk about prescriptions and will give you options, but they are always tied up by the constraints that traditional medicine is going to place upon them, okay? We don't get hour appointments anymore. We don't get to have 90 minutes if a patient needs 90 minutes. We're limited, right? 30 minutes, 20 minutes, 15 minutes, 5 minutes, you name it, double booking every 10 minutes or what have you. And even with their best intent, no provider can offer the same level of care in 10 minutes that they could in a longer visit. So one of the options that are one of the benefits we have at Victress being a direct primary care is we have that opportunity to sit down and take a little bit longer to go through options for you. I joined my first direct primary care 10 years ago, and it was wonderful. We were owned up by a company out of Indianapolis. They had about 30 clinics in Indiana and about 3 in Ohio. And I love the people I work with. I love the people I worked for, and I love the patients that I got to develop from there. But then that company bought out time and time again. They merged, buyout, merger, buyout. And before too long, I didn't even know who I was working for. I didn't know any of the owners. And quite honestly, we all looked around and said, this company has lost its way. All right, we are not who we used to be. And so coming over to Victress a couple years ago, getting to work for people who are living in Anna, Ohio, and in Jackson Center, Ohio, as much as I try and get them to come over to New Bremen to live with us in our town, it's still neighborhood, right? We're still close. So we're right there. Erin and Lisa do a great job of making us feel valued, of knowing our lives and giving us the opportunity to impact patients in any way that we can. So we kind of bring back a little bit of that old school, 50 years ago, doctor down the street approach. We have cell phone numbers that we can be in contact with you. You don't have to go through, incredibly more and more difficult apps. We're there, right? I want to come in sometimes if I'm available, if things aren't too crazy at home, to maybe come in on my own time to take care of a patient or to meet them after hours or something like that. Not because Erin and Lisa are telling me I have to. Actually, they tell me the opposite, right? They tell me you can shut off. You can close things down early. You can go home, be with your kids, be present. And in my heart, I want to do all of those things. But I also care about my patients, okay? Like they're my neighbors, like they're my family, like they're my friends. And so I want to help them, and I want to save them the urgent care bills and the hassle, and I want to just do whatever we can to take care of them. The final thing that we do at Victress that's a little different is we do it all through God, all right? We believe 100% that if you work through Christ and you do things the way the Bible told you to do them, things will take care of themselves. So that is my summary of Victress. We work through the way God taught us to bring you old-fashioned care, old-fashioned style with the most up-to-date research. We're going to give you the mundane. We're going to give you everything traditional medicine's going to give you. And we're going to give you that little Arby's flair, the little plot twist at the end where we can have the conversation about what else can you do to control those risk factors in the way you want.
Thanks.
Good.
Thanks, Bruce.
Thank you. It wasn't so bad.
He's right. I had no idea that we were going to the Arby's throwback commercial. Thanks, Bruce. All right, now what we've all been waiting for. Congressman Jim Jordan. Are you ready for the hot seat?
No, I don't know.
I know.
You got questions for me?
I do. I've got some questions for you. Yeah. So just yesterday, Trump rolled out the Great American Healthcare Plan. So Ohio's healthcare costs are crushing small businesses and families. In your judiciary role, how will you be able to apply antitrust to big insurers' practices under this plan?
Oh, Oh, no, that's not something I've actually really, I apologize for my voice. Got the cold on the plane yesterday coming home. I don't know that we've actually thought about the antitrust issue with big insurance. What we have thought about is the president's been clear, but he doesn't want them. He'd rather give money to families, to patients, versus giving it to insurance companies. So if you remember, last fall, the Democrats, it's not partisan here, but the Democrats shut down the government for 43 days. And it was all over the healthcare issue and all over Obamacare. So it seems to me when you're thinking about this expanded extension of the Obamacare subsidies, much better approach is to empower people, empower families with some of the things that the president rolled out in his plan yesterday. Health savings accounts, as Erin was talking about, much better approach than just. I always tell people, if you remember, with Obamacare, it's been about 15 years ago. Wow, about 15 years ago now. Everything they told us about it turned out to be false, right?
Yep.
Like your plan, keep your plan. Like your doctor, keep your doctor. Premiums will go down. 0 for 3. And now they want to extend it. They've already expanded this. Now they want to extend the subsidy going to insurance companies. Seems to me a much better approach would be to empower patients, focus on, as Erin's been talking about, patient-centered approach versus insurance and government-centered approach. So that's what we're trying to do.
Yeah.
As we move forward.
Yeah, that's great. Yeah, thank you. We'll look forward to that. So membership-based payment models average around, studies kind of vary, but around $2,400 in savings per patient per year compared to traditional fee-for-service billing. What would it take for direct primary care to be included in federal benefits, such as Medicare, Medicaid, and Veterans Affairs? I don't know if it would be like a bipartisan bill, clarifying that DPC isn't insurance and would allow federal payments, things like that. What would it take?
Well, project legislation, and you would want to do it in the context of what the president has proposed. You could even probably, to get, you know how our system works. In order to get something to the Senate, you got to have some Democrats buy into it. You got to get to 60 votes in the Senate. So you could. I even said this to our conference. You could do something on the Obamacare, extending that subsidy, as long as you married it with other good things that are actually going to help patients. So that's where you can get some. But if you just do the subsidy, as some of my colleagues want to do, then you're creating. I always tell folks, you all know this. You're all successful people, but it's economics 101. Subsidies increase costs, choice and competition lower costs. And really, the biggest problem it seems to be in healthcare right now is it's always we're not empowering the patient. We're not really having choice and competition. You can't have real true choice and competition unless you have transparency. Is one of the things the president talked a lot about in his plan. So that's where the focus has got to be versus on just spending more money and continuing this downward spiral we're in. Part of the problem with Obamacare too is it mandates specific coverage for everyone when you buy insurance. I always tell folks, some of you are as old as Polly and I. We don't need maternity coverage in our plan, right? He's like, we don't. So why mandate certain coverage in every plan when you want plans? Many young families want the higher deductible plan that fits their needs. They want that kind of approach when it comes to insurance products. So I think all those things, again, about empowering patients, choice and competition, versus this idea that the government's going to tell you how it's all got to work.
Well, I think to speak to that too, one of the things that we talk about all the time is why can't you wrap your insurance plan around a great product like a direct primary care? And that's what we're missing right now is things like that. So kind of tying into that a little bit, Congressman Jordan, the great healthcare plan promises over 10% premium cuts. What steps will you take in Congress to ensure big insurance can't offset those reductions by hiking prices elsewhere? It's over here, kind of hiding things through transparency rules, maybe antitrust enforcement.
Definitely transparency. You can't, like I said before, you can't get choice and competition if you don't know what things cost. So you got to know what everything's costing. I do think there has to be some reform done on the pharmacy benefit manager issue. when it comes to insurance. You see this is something that a number of my colleagues, I'm not on the committees that deals much with healthcare, some of my colleagues, but this is one area that they're really focused on, is some reform there, so that you have this entity in the middle that always seems to get a lot of money. Some reform there as well that we think can be helpful.
Sure. Yeah. Shifting gears a little bit. What keeps you up at night?
Last night it was this cold.
Oh, yeah. Sure.
Well, I mean, I tell people it's a great country. I mean, maybe I'll deviate from healthcare here for a
Sure.
second. We traveled to back in Thanksgiving week. We traveled to see one of our daughters, her husband, and more importantly, two of our grandkids. They live overseas, and we were in Italy. It's a great country, and the food, blah blah blah, but not as good as America. No place like this place. And so when you think about it, the division in our country today, fighting we're seeing up in Minneapolis as we speak, that's a concern, because it's an amazing thing that we have in the greatest nation ever, 250 years this year. It's a special, special place, and you want to make sure it continues to be the special place. So I try to think about that, and as the guy who gets to represent all of you, fight for the things I think you all care about. Am I doing it the right way to protect this amazing thing that we call America? And so that's kind of what I think about. And then the part I love about the job, I got to tell you, is when I get to go after the guys who I think are trying to undermine what makes America a special place. Like this coming Thursday, I get a chance to go after Jack Smith and a hearing. And I'm looking forward to that. But no, it is a great country. We're going to be fine. I won't brag just a second about. I do think the president is. It's almost a year to the day, that he was sworn in as president, and it's been an amazing year. There's just no. I mean, if you just listen to the mainstream press, you wouldn't know it, but it's truly. You've all heard me say before. I think we make the job too complicated. It's pretty basic. What'd you tell the voters you were going to do when you ran for the job? Put your name on the ballot. If you win, go do what you said. Nobody does it better than President Trump. Nobody. He said he cut taxes. He did. He said he'd get men out of women's sports. He did. He said he would secure the border. Did it in 4 months. Remember last year during the joint address to Congress, when he said, people thought you needed to pass a bill that would secure the border. Turned out all you needed was a new president, right? Yeah. It's like true. So he said he would stop Iran from getting nuclear weapons. He did. So here's a guy who does what he said, and he loves this country. Really does. Really does.
Yeah. Well, last question, Congressman. We've spoken about so much today: direct primary care, free market, big insurance, and now we even started talking about some more of President Trump's plan. If this audience leaves here today with just one takeaway, what should it be?
Victress Health is great.
I didn't even have to pay him for that. All right.
But I'll tell. So this was probably 2 summers ago.
Uh-huh.
So Polly and I were driving. I can't remember where we were, but we had this long trip, and we get back in Ohio. I don't know if you've all had this happen. Maybe Doc, maybe you've had this happen too. But your neck gets so tight from. Well, I don't know. It was like maybe I was stressed out from who knows what was going on. But we stopped in at your place down in Sydney.
Yep.
And these guys helped us out. And they're special. The way they focus on the patient, the innovative way that they focus on the patient, the faith-based focus as well, makes a difference. It makes a difference. They're doing really good work. And that's the kind of folks you want in your community, making a difference for the good folks that they get the chance to serve. So they were helpful to me, and I just Joe Bag of Donuts walking in off the street, and they helped us out. But I said this: good things in life don't just happen. You want to accomplish anything that matters, anything of importance or significance, anything that has lasting value, it takes time, it takes work, it takes effort, it takes sacrifice, and those are the qualities that these guys have. And they really care about the people they get the privilege of serving. Absolutely. In their faith-based personal way. So that's they're special folks. That's why I'm here with the cold on a Friday afternoon. Congratulations.
Thank you.
Well, don't
Oh,
do that.
yeah, that's right. That's right. Well, thank you. Thank you. Well, I know Congressman Jordan is very busy today, so I know we're going to need to wrap this up, but I couldn't think of a better way to end this. Thank you all for being here today. And Congressman Jordan, we look forward to seeing your work in action. But just a reminder, if we don't change, nothing changes. There are solutions right here in our local community. Engaging in the solutions right here in Lima will help us to build a better America. On behalf of Victress Health and Wellness, we wish everyone a wonderful and safe weekend and safe travels, everybody. I know it's snowing again. So thank you. Thank you all for coming.
Thank you.